time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
All right, folks, how about if I tell you over 33 million people suffer from this? And women account for 85% of all the patients. What is it? It's overactive bladder. And remember, folks, I know what you're thinking. This is only for the old people. It's not for the old people. We're going to learn a lot about overactive bladder, and I think it's a show that's important for everyone to listen to. My guest today, Dr. Sheila Hockman from the Alliance Group, here at Alliance Medical Group in Hazleton, Greater Hazleton Health Alliance. And it's going to be an interesting show, folks, because I said over 30-some million people are affected by overactive bladder. The good doctor, how are you?
I'm good. How are you?
It's nice to see you. How's everything at home?
Everything is good.
Family's all right?
Family is fine. The only thing interesting is my son finally asked his girlfriend of 13 years to marry him.
Well, it takes a little time now, the nurturing factor, so I wish him the best, okay?
Thank you.
And your husband's doing okay?
Yes, he's coming along. Just had his ankle reconstructed, so he's been a real bear, shall we say.
We're supposed to be that way. Remember, men are the biggest babies. I've said that many times. Not like women. I admire women. So tell me a little bit about yourself.
My husband is basically a Pennsylvania boy, and we lived in Bucks County for over 18 years. I went to medical school in Philadelphia and undergrad just outside of Philadelphia. And prior to coming here a year ago, I did 10 years of rural underserved medicine. So that was very eye-opening, I must say.
Why did you decide to become a doctor?
I probably was born that way. I can never really remember wanting to do anything other than that. So.
And going into this particular field, it's something that you wanted to go into?
I did.
Yeah. Well, overactive bladder now, okay, and I said there's like over 30-some million people that are affected by this, and mostly women, okay? What is overactive bladder?
Well, I like to explain it to my patients. It's when your bladder is in control of you. It's the symptoms of urgency, frequency, with or without incontinence. Most of these patients of mine can tell me where every bathroom is within a 100-mile radius. When they get that urge that they have to go to the restroom, it's uncontrollable. And most of these girls, if they cannot get to the restroom, they will leak.
Mm-hmm. Now, how prevalent is this condition?
Well, 33 to 37 million women are affected by this, but it's not just women. Men can have it too. It crosses all age groups.
Now, when you're looking at overactive bladder, now people will be watching the show thinking, well, I have to go to the bathroom, but does that mean I can hold it in? But
right.
Do I have overactive bladder? And how do I really know if I have them,
right.
an overactive bladder?
Well, usually if you can tell me that you go to the bathroom more than 10 times during the day or more than 2 times at night, that's an overactive bladder, meaning your bladder cannot store the proper capacity that it should.
Mm-hmm. Well, doing that, there are some people that, drink a lot of water, all right? And, certainly drinking a lot of water, you're going to have to go to the bathroom.
Right.
Now, are there, so here again, what would be my rule of thumb before I would say, okay, let me give Dr. Hockman a call and come and see him, but I do drink like 8, glasses or 4 bottles of water or whatever per day.
Right. Well, that's a little more complicated. That's not something that they could easily answer on their own. Because once I see them in the office, I actually have them do what's called a voiding diary. And they write down every ounce of fluid that they take in, whether it's water, coffee, tea, milk, no matter what. And then we also have them measure their output. And what we're looking for is their balanced output. Now, some women will overhydrate themselves, and that, we're used to telling people hydrate, but there can be a flip side to it.
Yeah, and I think that's always a concern, where they're doing that. Now, what are some of the causes, talking about drinking water, what are some of the causes of this condition?
Well, it can be previous surgery in the pelvic area. It can be something traumatic that has happened to them, accidents, spinal cord injuries, can cause this. And then there's times where we just don't know. Sometimes it's dietary.
Right. Now, in order for me to understand if I do have an overactive bladder, okay, for those viewers that maybe are urinating a lot more than they should be, what would be your advice to them?
Well, if they're concerned that they have it, I would keep a log. How many times do you go? Do you go a lot? Do you go a little? And that is an excellent place to start. You know, write down also, what are the foods you consume? And if you are taking in a lot of caffeine, chocolate, spicy food, greasy things, vegetables such as tomatoes are very irritating to the bladder.
Oh, is that right?
Yeah.
Oh, Italians have a problem.
They do.
We have a serious problem. So why is that?
It acts as an irritant.
Is that right? Mm-hmm. So what would be the rule of thumb, you know, as far as hydrating? You know, how many glasses of water should we drink? I mean, how much coffee should we have? You know.
Well, I would say it goes back to the old thing that we learned in elementary school: 8 ounce glasses of water in a day. Coffee. Yeah, I know, but that's what you need. Mm-hmm. Also, probably no more than 2 caffeinated beverages. Mm-hmm. Absolutely stay away from carbonation.
Yeah, that's always a concern.
Yeah.
Those people that are going to the bathroom frequently, and if you're drinking 8 glasses of water, well, like how many times should you be? What's the normal amount of times you'd be going to the bathroom?
To the restroom. It would be less than 10 times in a day.
So if you're going more than that, then it's something. So if I have thinking I'm having this, particularly with women, and why is it with women mostly than men?
Well, I would have to say that women are the ones that have more pelvic surgery, number one. Childbirth can also contribute to this, and they're going to be the ones that are more likely to present to the physician. Even though men can be bothered by this, it's not so much a bladder storage issue with them, it's more of a prostate issue.
Mm-hmm. So then we do have, so we call you, mm-hmm. Okay, so what would be the examination? Like if I think I'm having this, and folks, let me put her phone number on the phone while we're at it. This is Dr. Hockman, and her number is 501-6450. Also up there's a video that you could go and watch, and I highly advise you to go to this video. It'll give you a lot more information on what we're talking about, and it's on your screen right now. And it's interesting. You know, you don't realize when you see 30-some million mm-hmm. people. Okay, then you break it down. You have a couple 100,000. You know, in northeastern Pennsylvania that probably have this problem, don't even know they have it. Okay, all right. Assuming I think I'm going more than I should. First of all, is this a serious condition?
It's not life-threatening. It's more of a quality of life issue. If you enjoy going to the restroom more than 10 times in a day, then you don't have to do anything. Mm-hmm. But most of these women will tell you that their daily life revolves around, where's the bathroom? You know, I have to wear something that's easy on, easy off. Mm-hmm. So.
All right, so I call you and say, Doc, you know, I'd like to come for an appointment. I think I may have overactive bladder. Something to be scared about, first of all.
No.
Okay. So what would be what's the process then when I come in?
Well, when anyone comes in, the first thing they get is a full physical, and that includes a full pelvic exam. And with that, we're looking for, is there a structural issue for them to be having this issue? Do they have prolapse? Sometimes these things can go hand in hand. So we would evaluate that. If there is no structural issue, then we would go on and look at our standard treatment algorithm that we go through, which is, okay, let's do the voiding diary. You know, how much do you take in? What's your output? What are the foods you're eating? You know, is there medications? You know, a lot of our hypertensive patients are going to the restroom frequently because they're on diuretics.
Well, and here again, you know, this is a concern for quality of life.
Right.
But really, it's also something that if you are going many more times, okay, there could be other things that are involved that you may not.
Right.
Yeah. And what?
And, you know, it may not be just a overactive bladder. You could have stones in the bladder. You could have polyps. You could have strictures in the urethra that are causing these aggravating symptoms. So it's something that needs to be looked at.
Okay, now, when you begin to say that, okay, and some of our viewers are out there, and remember, you're talking to the biggest baby in the place of the earth. Okay, it took me 3 years to go for a colonoscopy, okay, and it's a piece of cake, really, and thank God, you know, I went. But now, you know, every so many years I go for that. But it took me, but now I'm saying, what if they find something? Oh my God, I'm not going there. I'm afraid they're going to find something, you know. And you're a nervous wreck. But fortunately, I would assume that it's good to find, if God forbid there is something there, it's best to find it really quick, isn't that?
Absolutely. And the bladder is probably one of the most forgiving organs in the body. Most of what I do to examine and treat these patients are pretty much painless. So there's no reason to procrastinate for fear.
All right. Folks, I'm talking to Dr. Sheila Hockman, okay, from the Alliance Medical Group, and she's an expert in the causes of overactive bladder. We come back, we're going to talk about some of the treatment options available. And you know who you are. You know if you're going more than 10 times a day, you want to give her a call. Once again, I'll put her number on the screen. Sammy, if you would do that, 501-6450. And also there's an opportunity to go to this website to watch the video. It is very informative. We come back, we'll talk about treatment options available and the procedure, a new procedure, folks, that could help you with this particular concern. Stay with us. Welcome back to the Sam Lesante Show, folks. Remember, 24/7 SSPTV.com. My email, sam@SSPTV.com. Thank you for the great comments. My guest today, Dr. Sheila Hockman. Now, folks, what are we talking about? Overactive bladder. Over 37 million adults in the United States, 1 in 6, suffer from overactive bladder. Women are twice as likely as men to experience urinary incontinence due to pregnancy, childbirth, menopause, etc., etc. However, this is not only, as you can just see, for older people. Now, we're talking about bladder control, the bladder, and so we come to you, and I do have an overactive bladder, I assume, okay? What are some of the treatment options available?
Well, the first thing we do is we always want to make sure we start at the most conservative measures first. And that would be dietary. We're going to look at your diet. Remove anything that's considered a bladder irritant. And when people come to my office, I give them this big, long list, and I call it the naughty list. It's the stuff that we want to try to eliminate and see if it corrects the problem. If that doesn't work, then we'll try medication. There's a ton of medication out there. The problem is that it has numerous side effects. Most people will stop using it within just a few weeks to months because of the dry mouth, the constipation, dizziness, the medicine, okay. And even blurred vision. So with that, we also train them how to properly do Kegel exercises. I know we've heard about them over the years, but a lot of people just really have not been trained how to do that.
And they're not difficult.
No.
Because my wife was showing me last night, as she, Debbie's a registered nurse, and she was, she's, these exercises, she was explaining how it's done, and it's not really a difficult thing.
No.
So you have some of the options. Now, there is a new procedure, okay, interstim therapy.
Yes.
Now, this sounds to be exciting.
It is very, very exciting. I like to break it down into the very simplest terms. It is the equivalent of a pacemaker for your bladder. Excuse me. Normally, when your bladder gets the signal that it's time to go urinate, you get the signal from the brain, it goes to the bladder, and then it goes back up, okay, it's time to urinate. Well, when people have overactive bladder, it's like the brain's going, you gotta go, you gotta go, you gotta go, you gotta go, and it doesn't give you the opportunity to control that urge to get to a restroom in a timely fashion. It's like this overriding impulse. Well, what the InterStim unit does is it helps to moderate that. It helps to put you in control of your bladder instead of your bladder in control of you.
That's interesting. And now, okay, so is this a procedure that you perform in the office or?
Well, I like to do it in the hospital for various reasons. but it's done in a two-step process. It's the only reversible procedure for bladder control that the person can actually try it before they buy it. So what we do is with the first phase is they go into the hospital as an outpatient. We place a temporary implant. You know, it actually is about this big. And
size of like a quarter or
yeah,
half a dollar? Okay.
And they wear it 3 to 7 days. They come back to the office. If they're happy, then we schedule the permanent implant. Now, the permanent implant is a little more invasive simply because I have to make a 2-inch incision just at the small of their back and to implant the little device. And that's it. The device is good for 5 years. And the reason for the 5-year limitation is we have to just go in and change the battery.
Isn't that something? Now, is this something that is, very visible? Women are very concerned about their looks? No.
It is not visible. The only thing is you can't go through a metal detector without it going off.
Yeah.
So
you have done this procedures on some,
Yes.
I'm sure many patients, and what are some of the results?
fabulous. Absolutely fabulous. I've had young women, actually one of my most recent ones, she was young, was active in CrossFit training, and she said for the first time in several years, she was actually able to make it through her workout without having to stop and go to the restroom. And
what is it? It's called the interstim, right, therapy.
Right.
And what does it actually do, Doctor?
it actually is sends impulses to the nerves.
Now, could you feel this in your? Could you feel it?
Initially, you will. It'll be like a very faint vibration that's felt, deep in your pelvis. And but with all things, your body gets accustomed to it over time. Also, for example, if you are going out to eat with friends, family, and you love your Italian food, but it's a bladder irritant to you, then you have this little handheld unit that you can actually place over the implanted device and control the amount of stimulation you are getting. You can turn it up, turn it down in an effort to control your symptoms.
Is that something?
Right.
Now, how long has this been out, this new procedure?
Since the 90s.
Is that right? and so if we had some of your patients here, some of them, coming in, maybe a little doubtful, a little concerned, and you work, you talk them through it, you work it through them. Now, after it's like, everyone's always nervous before something happens, okay? So you could tell me, with a lot of confidence that it's something that works well. Nothing is ever 100%, but however, you're hitting a good percentage there. And now, how long is the recuperation after this procedure? When they say recuperation, that means to me that like I must be out or.
No.
See, I get a little nervous when I see recuperation. What do you mean recuperation? I thought this is a simple procedure.
No. The first phase, there is no recuperation. You can leave the hospital and go about your normal activities, with the exception of driving because you've had sedation. With the second part of it, you're going to have a little incision that big, so I'd take it easy a day or two just so you don't open up your incisions.
Folks, I'm talking to Dr. Sheila Hockman, and she's an expert in bladder, in the causes of overactive bladder. Now remember, it's not for old people only, folks. We have a lot of young people who have this particular problem. I would highly suggest if you have, just check it out. If you're going more than 10 times a day, you want to give Dr. Hockman a call. And the phone number, Sammy, you can put it up on the screen, it's 501-6450. Give her a call. And also that video, if you get a pen and paper, I'll put it up a couple more times. Go to that website and look at that video. The more I like to inform people. The more they understand, because everyone's apprehensive. When it comes to doctors, and we're all apprehensive. As I said, I'm one of the biggest babies. When you do this sampling or whatever, when the procedure, how long after will I begin to see results?
Immediately.
Is that right? It works that fast. So actually, this little machine is telling the brain what to do. And that's incredible, when you think about it. So now, can I do that on my own? Say, okay, look, I'm going to tell my brain, I don't have to go.
No.
So maybe I could bypass the therapy or the treatment.
No.
It doesn't work that way.
No.
So the brain won't listen to me.
No.
You need some other help to tell me what to do that. How does that work?
Well, where it's implanted, it's a little bitty fine lead that's no more than a hair in width, and it goes down and is implanted in a part of your sacrum that is where the nerves that control the bladder are. So it helps to control that impulse that's coming down from the brain to the bladder. So it helps regulate it and go, no, not yet. It's not time.
Well, so could it work in the reverse, that you really the bladder's taking too much in and it doesn't release? What happens? Does it say?
It could, but that's something that would have been picked up on an exam and a complete history of the patient.
Okay, so therefore we can sort of like eliminate that particular problem.
Right, but kind of a flip side to this is urinary retention, and a lot of our spinal cord injury patients are unable to empty their bladders. They have the exact opposite problem as this, and this device is actually used for them also.
So it's, here again, it's nothing to be really that much concerned about.
No.
Okay. I mean, it's something that you should address because you're talking about the quality of life. And those people who have this condition know what it's all about.
Absolutely.
Running to the bathroom and not enjoying the quality of life that they have. So the procedure is a simple procedure, and it can be done as an outpatient. And the time to recover is really not a serious recovery. It's just a time thing. And you've done a lot of these, right?
Yes.
Okay, now the procedure is called InterStim, right?
Yes.
Okay, and it's a little unit like
Little
this.
tiny pacemaker.
Okay. Now, the other question with this, some people may have a concern, have a problem. Will this InterStim therapy procedure be covered by health insurance?
Absolutely.
Okay, so I don't have to worry about,
No.
okay, the health insurance. Now, if once again, let's review this for people who just tuned in. If you just tuned in, folks, I'm talking to Dr. Sheila Hockman from the Greater Hazleton Health Alliance. And remember what I told you for many years, going back to '94, folks, we have excellent doctors in this area, excellent caretakers. There is absolutely no reason to leave this area. Even more so now with the fact that they're advancing with the Lehigh Valley. We are very blessed to have people like Sheila Hockman in the medical, and I mean that sincerely. I've always, it's a pleasure to interview a lot of doctors from our area because we do have a lot of, I mean, 99% of them are great. Yes, you have one or two that I wouldn't give you 2 cents for. But that's the way it is, okay? Those doctors know who they are when they're bad, okay? But we have been blessed, you know, with doctors. With that being said, explain to us what overactive bladder is and what you can do to help that.
Well, in a nutshell, overactive bladder is urgency frequency with or without incontinence, meaning you go to the bathroom more than 10 times during the day or more than 2 times at night. Therapies that we can use are everything from dietary modification to medication, Kegel exercises, and then InterStim.
Now, you mentioned something about, you know, this is primarily 85% hits women with this.
Right.
But some men have this.
Yes.
Okay, so some men will call you and say, look, I have that problem. What if it really isn't an overactive bladder? Can you tell whether it's prostate?
That is hard to tell because I am not really trained to deal with men, but most of the time these are gentlemen that need to be seen by their urologist because they will need a complete prostate exam. They'll probably need a cystoscopy to make sure that there is no encroachment of the prostate gland onto the urethra and the bladder.
Okay, so maybe what I should do if I have an overactive, if I'm going more than I should be, particularly during the night, is see a urologist first.
Well, what you need to do is seek a healthcare provider, number one, that you trust. They can do, right, or your family doctor, and they can take down questions and concerns of yours, and based on their preliminary findings, they can say, this, you know, you're a gentleman, this is your prostate, you need to go see your urologist, or go see your gynecologist. But another thing is to remember, not all urologists and not all gynecologists are trained in InterStim.
Yeah. And that's important, okay?
Right.
And now how long have you been doing this InterStim procedure?
I would say since about '98.
Is that right? And you've had some great successes. So once again, you know, you have this modern technology out there. There's no reason for people to have that kind of quality of life. Now, do I have to go to my family doctor before I call you? Because I'm putting a number up here. On the,
No, you don't have to.
Okay, so all right, folks, let me put that number up again. Dr. Sheila Hockman here, who is an expert in the causes of overactive bladder. Been doing this procedure for many, many years. It's called the interim therapy procedure, and it's a simple procedure, as you just heard. Her number is 501-6450, and Sammy, put that website up. I would go and watch the video. There it is. Now, you know the show is seen many times. We could also watch it on the internet. So in case you heard about the show and you don't have the schedule, our schedule's up on our website as well as in the standard speaker. It would be imperative that for you to get the information. But look at this video and you'll be able to learn a lot more. Well, good doctor, thanks very much, and good luck to your son. Hope everything works out well.
Yes.
And husband gets better and back to work and everything else is fine.
Absolutely. Thank you.
You like the area, doctor?
I do.
Yeah. But how do you feel about the merger? This is going to be a pretty interesting thing.
I am very positive about it. We had a good relationship already with Lehigh Valley, and I think this is just going to make it better.
Well, I wish you the best, and to you and your family, and keep up the good work. Okay.
Thank you.
Folks, remember SSPTV.com 24/7. My email is sam@ssptv.com. And when you see your medical people that are working in the hospital or different, be kind to them. They have a lot of stress on them, and sometimes you feel like, well, they didn't say hi to me, they didn't say hello. There's a lot of things going on. Our healthcare system is very challenged these days. So we're very fortunate to have the great nurses and aides and assistants in our hospitals and different offices. So be kind to them. We'll see you next time.